Good evening, everyone. Thank you so much for joining us. I'm excited to have Kylie Waylagi from MyChoice Wisconsin joining us, who's going to be talking about self-directed supports in family care and family care partnership. Kylie's been with MyChoice Wisconsin for over 7 years, working in various departments, but for the last 3 years, she's actually developed and led the MyChoice Self-Directed Supports Department, known as the Community Support Team. This team provides training and guidance regarding self-directed support and other community services to the entire organization, as well as its members. Kylie has developed a passion for self-direction and managed care, as this method of receiving services is the essence of the organization's mission, keeping members as independent as possible. And she has seen firsthand how the use of self-direction provides opportunities to members, giving them independence and control of their care. Kylie was born and raised out in Lake Country, Wisconsin, and is thrilled to bring her knowledge on self-direction and managed care to her hometown. And outside of work, Kylie is busy raising 2 young daughters, party planning, and spending a lot of time outside. So thank you, Kylie, for joining us. I'm just going to ask or let the attendees know, please enter your questions into the chat box and we will answer them throughout. I will help moderate. And then I will just pass it over to Kylie.
Wonderful. Thank you, everyone. That was a wonderful intro. Nothing I need to say more. I'm Kylie Waylagi, my title is Manager of Long-Term Services and Supports, but MyChoice really knows me as a Community Support Team Manager. There's a team of 5 of us that directly work with self-directed supports. The content experts in that regard. So I'm here to discuss self-directed support in MyChoice Wisconsin.
All right, you froze there for a second,
right.
Kylie, just so you know.
Oh, am I back?
Yep, you're back.
Okay, perfect. So MyChoice Wisconsin offers multiple programs, but today we're focusing on our family care and family care partnership programs, as those are the programs that offer self-direction. So I'll just shed a little light on both of those programs. If you're not familiar, both programs are Medicaid long-term care programs that help elders and adults over 18 with physical, developmental, or intellectual disabilities. Members of these programs receive services to help them live their own home whenever possible. The goal is to keep our members as independent and active in the community as possible. Both programs are funded by state and federal tax dollars. I am going to turn off my video because my internet, I can tell, is already going in and out. Okay, so there are some differences between the 2 programs. We invite you to visit the MyChoice Wisconsin website for information and resources on all of our programs and just the qualifications and on how to enroll into our programs. If you are interested in MyChoice Wisconsin, contact your resource center. They're going to be the best option for you to determine which program is the best fit for you. So as I stated, there are differences between the family care and family care partnership programs, but the main goals are really the same. A main goal is to ensure that you, the member, are safe and supported at home. I'll just say that I say you a lot in this presentation, and that is directed towards, the member of this organization. So when you live in your own home or your family's home, you have more power over your life. You can decide when to do certain things, such as when to wake up, eat meals, how to plan your day. When you join either program, MyChoice Wisconsin will talk with you about what services will help you live as independently as possible. Help with bathing, transportation, housekeeping are some of the services we offer. Services may include building a wheelchair ramp or using a medical alert system, so a wide variety. MyChoice will make sure you get the care you need to be healthy and safe. We will also help you maintain ties with your family, friends, and community. And that's really what STS is all about as well. If you are a young adult preparing to move out on your own, MyChoice Wisconsin will help you become more independent. For example, we help with help you develop skills you need to find a job or to learn how to prepare meals or any of those tasks within your home. So who is on your care team? You are an essential part of your care team, and you, the member, should be involved in every part of the care planning process. When you become a member of either program, you'll work with a team of professionals from MyChoice Wisconsin. You will be assigned a care manager and a registered nurse as part of your team, and they'll also be your primary and main contact and managers of your care plan, kind of your go-to for everything. They're there every step of the way. And I'll say that multiple times throughout this presentation. We have subject matter experts available to assist in any of your unique needs or to assist the care teams in those needs. For example, myself and my team would be considered, a content expert for self-directed supports. Other professionals, depending on your needs, such as occupational or physical therapists, mental health specialists will be part of your care team, and just anyone else you, the member, wants to be involved, including close family members, friends, neighbors, whoever is important to you to be on your care team. And then lastly, what does my care team help me with? Anything and everything. Your care team, again, is there with you every step of the way, creating, updating your care plan, making changes when needed, determining your health and long-term care goals and outcomes, service coordination, ensuring that you're functional and financially eligible for the program ongoing, and then of course, self-directing your services if that's the route you choose to go, and employment in the community if that's your initiative. All right, so we are here to talk about SDS, one thing available within both programs. And what you're here to learn a little bit more about today specifically is self-directed supports, or what I'll probably reference as SDS quite a bit. I think in talking to my brief communication with Katie, it's my understanding that this particular community might be more familiar with the IRIS program, which is, heavily involved in self-direction. And I think there might be, often some misunderstanding in that MyChoice or other MCOs cannot provide self-direction as an option, but we very much can and very much do for a lot of our folks. So let's talk about what self-direction is, if you're not familiar, and how it works within our MCO. All right, self-directed supports are based on the core values of self-determination, which is a fundamental principle of our programs. Self-determination is the principle that our members are in control of their lives and are the experts of their needs. They have the same right to participation, control, option, freedom. I don't know why it's doing that, I apologize. And self-determination as all citizens. So these are some of your core values of self-determination, choice and control. Individuals get to make decisions in their own life, including regarding their care, who provides their care, and how it's provided. Dignity and respect, the right to take risks. Individuals have the right to be treated as a whole person in a dignified manner and are able to take risks in their own lives and make those decisions. Relationships, individuals choose who they want in their lives, including friends, family, caregivers, contribution and community, and fiscal responsibility. Self-direction, our program allows members to expand their self-determination by having even greater control. So finally, what are self-directed supports? Self-direction is a way for members to take a more active role in managing their long-term care benefits within the program. Self-direction is built on the idea that the individual receiving the service and supports are the most familiar with their own needs, so are best able to direct and manage their plan. Members actively direct the supports and services being provided to them utilizing a budget developed by MyChoice Wisconsin. So that's the unique thing about self-directed supports, is that it comes with a budget. We'll talk more about that. Self-direction allows the member to hire individuals who they are familiar with to provide their care, including friends, family, and neighbors, members can use individuals and providers that they trust and may already have working relationships with. And that's a huge benefit and reason why people lean towards self-direction.
Kylie, you mentioned, the hiring a caregiver, things like that. So what if a self-directed support is not contracted with My Choice? Is there a way for them to become contracted?
Yep, absolutely. So if there is a provider that a member is interested in using, the first thing we're going to do is reach out to that provider and ask if they want to be contracted. If they don't want to be contracted, if there's some sort of barrier, oftentimes SDS can be utilized to creatively utilize that provider in some capacity. So that's something that my team often talks with the care teams. That's when we get involved to say, how can we creatively do this if they're not going to contract or go out of network or something like that. So I'll provide many examples in this presentation, but just to kind of give a better idea of what we're talking about here with self-direction, the most common service that is self-directed is supportive home care services in the home, such as, assistance with personal care tasks, bathing, dressing, meal preparation, cleaning, just to name a few. Through SDS, a member can become the employer and hire an individual of choice to become their employee to provide that supportive home care service in their home. So they might hire a neighbor or a friend, someone that they trust, to be paid to complete that service and support for them. Members hire their caregivers, and then there's that employee-employer relationship between the member and their caregiver.
Kylie, would that be the same for like a 24/7? I'm guessing like a paid nurse or something like that.
Yep. Yep.
I'm not quite sure what PDN stands for, but I think it's paid nurse with the program. So they could hire someone to do that function.
They can. Yes, they certainly can. We have folks who have nurses in their home that they want to remain in the home, and that's their goal. And so we explore all cost-effective options. And if a great option is hiring a nurse that they know to provide the care in their home, they can certainly do that.
Great, thank you.
Of course. Self-direction can include. Go ahead.
Oh, I'm sorry. What about driving? Our son is pretty highly functioning.
Yep.
But driving is our biggest obstacle is him being able to get where he needs to go without having to, have mom or dad or stepdad or, sister or somebody constantly asking, can you do this? Can you drive me here? Can you drive me there?
Yes.
Very difficult because the services that are available are so slim, and a lot of times they're only available from maybe 9 a.m. to 5 p.m. Nothing after that.
Yes.
Not my son, is a minimum wage worker, and most of the jobs available to an unskilled individual like that are going to be in restaurants, grocery stores, or places that need them on the weekends, or he's going to school at Journey 21. He can't do a job until 4 or 5 o'clock, and it's been really, really difficult. And Uber is just ridiculous. It's out of the question. It cost us one time $45 to get him to work in a 10-minute drive away.
Yep.
One way.
Yep. Oh, yes. I hear your concerns, and I'm very familiar with them. So being on the community support team, SDS is kind of our main subject that we oversee, but transportation is also another one. So I'm very familiar with the barriers and the needs for transportation. And just like you said, a lot of it is weekend transportation, early morning, late night. It's hard to find. It's hard to come by. But that is one thing that we can certainly find creative ways to make that work. Transportation is a huge need among most of our members. So if that's finding a contracted provider to meet that need, if it's paying for cab coupons, if there's a cab available, if it's through SDS, which I actually have I think a pretty decent example in this presentation of a member needing transportation. If it creates a hardship of family members or friends transporting, we can set them up through SDS, and they can be reimbursed mileage. if that's a need that needs to be met for that member. So we can find creative ways through SDS to make that work or find a contracted provider.
Can transportation be covered outside of SDS just with your
Yes.
general,
Yep.
like the My Choice Wisconsin team?
Yes. Yep. And that's what I mean by contracted provider. So we My Choice Wisconsin contracts with hundreds of different providers in different service categories, transportation being one of them through across the state. So our care team, they're going to call any and all transportation provider that we're contracted with to see if they can meet this member's needs. And that's the route they'll probably go if everyone on the care team is in agreement, the member, a family, and if it works out. And if it doesn't, sometimes we go the SDS route. It really depends on what that member's needs are, who's available, and what their preferences are.
So
Okay,
the
so
case manager should be helping with that, correct? And
Oh,
not,
100%.
okay.
The care team will coordinate all services.
But
Yep.
that's a station is outside of SDS. It's a completely different support, you're saying.
It is. Yep. It's a different support, but within the same program. So SDS is just kind of that one-off, aside from our contracted providers, but your care team can help with both. And your member can have both. They can use both a contracted provider for some of the transportation. And then they could also, maybe on the weekends, if, the cousin or brother, sister-in-law wants to drive them or is the only person available, they can be reimbursed through SDS. So it's not all or nothing. It can be both within the program.
Yeah, well, I and maybe I am jumping ahead here by even broaching this subject, but for example, with Kai getting to school, we got, My Choice said, well, yeah, we'll cover one way, but you have to drive the other way. We had to figure out what our work schedule was and go into work late in the morning so we could drive him in the mornings, but he only gets, picked up in the, and, that's difficult.
No, absolutely. Absolutely. I would like to work that was with My Choice.
Yeah.
Yep. I would like to work through that. I'd be curious what the rationale for that was. Is it because the provider didn't have the availability?
I don't know. They just were like, well, it wasn't even that they told us we can do afternoons. It was, they said, we want you to do half the driving. And I was like, oh, well, this isn't working towards independence at all because we have jobs, and my goal for him is to say, I need to get to the grocery store, or I need to get to school, or I need to get wherever. This is the service that I utilize, myself. I organize.
Right. So Kylie and Shanda, I can connect you with Kylie. So you can maybe get deeper into that after the webinar, because I definitely think that can be addressed.
Right.
Absolutely. Yes. Let's connect after this. There's ways to meet that need. Care teams are always trying, and we'll talk about this too, always trying to find the most cost-effective option, right? Because we're a Medicaid program. So if it's SDS often is more cost-effective than a contracted provider. So I don't know if that was their, what they were going towards, but let's talk through that.
Yeah.
All right. So Kylie, quick question. I know if people can choose their nurse, but would the My Choice help a person find a private duty nurse rather than, in Iris, you're kind of, I guess you have your consultant and they help you, very often help, but would My Choice help you find a nurse?
Yep. We have different avenues to do that. We will first help, the member the way they want to recruit, if they want to put out Facebook ads or something like that, we're going to support that. But we do have other avenues. We have different services actually that we can authorize. A support broker service is a specific service that we contract with that specifically recruit for SDS caregivers.
So is that like a home health agency kind of?
It's almost just like a recruiting agency.
Oh, okay. Cool.
Yep. And it's through it's actually through one of our fiscal agent providers that does SDS. So they know and they get SDS. And so they'll work very, very closely with the member to recruit and include them in the interview process. And really it's kind of the member driving it, but that agency will we'll do kind of that legwork.
Okay, great. I just have one more question. It looks like, can a member use self-directed supports while living in a group home? Because they would like to add more fulfilling activities and a one-on-one support community-sponsored events, which the group home doesn't do. They just sit at home at the group home.
Yeah, that's one we get all the time. I'll go through what is and is not covered through
Okay.
SDS. But that being said, like we say you can't self-direct residential services, right? Because we're contracted with residential. But if there are services that are not covered within the residential, we will be creative with SDS to make sure that you're getting what you need. And we will see that quite a bit where there are specific activities, they're not engaged enough within their residential facility. And so if we can find a way where they have a relative or a different community or provider to provide what they need, that can be an option.
Wonderful. And then the care team is just the nurse and the case manager, right? What are their caseloads typically?
Oh, now I believe it's still 40 for
Okay.
a care manager. And then I believe nurses still are at about 60.
Okay.
Because the care managers are the ones seeing the members more often, talking to them more often. Unless it's a more medically complex member, then that RN will certainly step in. But I think that's why there's a difference in caseload capacity.
Absolutely. Thank you, Kylie.
Of course. All right. Why might a member self-direct? So when you enroll into a family care and family care partnership, we just kind of touched on this. Members will have access to hundreds of our contracted providers for many different service categories. So supportive home care agencies, transportation agencies, and so on. Based on the member's assessed needs, the care team will assist in coordinating those services. So why might a member explore SDS as an option, or why might the care team suggest this option as a method of service delivery instead of using one of our contracted providers? There's many reasons why a member may want to explore SDS. It's very unique to that member's needs and particular experience and situation. So the member wishes to have more control over his or her services or life. The member has natural supports who have long-standing relationships with and just more experience with the member versus an outside agency. A lot of times they just feel more comfortable with a friend or family member providing that service. The member may need more flexibility in scheduling services. Member has strong preferences for who provides his or her services or how services are provided. More creative use of supports and services is needed due to limited providers or community resources for unique member situations. So kind of the things we already, touched on, some of those unique circumstances, that's where SDS might come into play. Or the member might just be dissatisfied with a traditional service provider. The care team will assist members in identifying if and when SDS is the most effective option for them. So a little bit about what can and cannot be self-directed. And I will just say that I'm not an expert in our long-term care service plan, services, benefits, as I am, SDS. So I'll do my best to answer those questions if they come in. Members can choose to self-direct pretty much all of their services, with a few exceptions. Hang on here. To self-direct a service, that service must meet one or more of the member's long-term care outcomes listed on their care plan. And so those outcomes are really your goals. What are the goals? We need to meet those goals. So if we're going to authorize something, what need are we trying to meet here? I apologize. This is just kind of going rogue. All right. These include all of the service within the home and community-based waiver benefit package within the Family Care and Family Care Partnership Wisconsin Department of Health Services contract can be self-directed. Specific examples and what we see most of the time, some of the more traditional Self-directed services are going to be chore services, companion care, daily living skills, training, respite, snow and lawn care, supported employment, supportive home care, which is like your attendant care, homemaking care within the home, and transportation. What cannot be self-directed is what we call bundled services. And really, we're talking about residential, what I kind of mentioned. Members can't self-direct residential services. We're contracted with residential placements. So we'll contract and we pay for those residential through a contract. If a service is included in that residential service rate, then it can't be self-directed. And there are always exceptions. A good example of this, and we see quite a bit, is a member residing in a group home, and they typically cannot self-direct transportation because that residential provider is expected to provide that transportation and they're paid to do so. And so that would really be a duplication of service. However, members have unique needs and we understand that. And so we're always willing to talk through those cases. And if a member really wants to self-direct a transportation, residential can't do it, we can talk through that. And that's something that that can be done. Care management services cannot be self-directed. You receive care management services with MyChoice. And then services that are included in the Medicaid state plan benefit package cannot be self-directed. This includes, but is not limited to, the services listed here: AODA services, community support program, disposable medical supplies, durable medical equipment, home health services, nursing home stay, physical, occupational, and speech therapy. That being said, services with asterisks indicate that there are certain rare circumstances where self-direction would be an option. We just require consultation and exploration of all other options, and look at cost effectiveness prior to utilizing STS. So again, we're always using STS to meet those unique needs.
So question, Kylie, that we had. So they wanted to know kind of specifically, what do you provide through SDS that Iris would not? I know you can do like residential through Iris, but very frequently, sometimes it's not within the budget, is my understanding.
Right. Mm-hmm.
So I know that can be difficult, but you can still get funding through MyChoice Wisconsin. It just can't be self-directed. Correct?
Yeah. My knowledge of Iris is somewhat limited. I know with Iris, I'll talk about the budget system with an MCO, at least our MCO through SDS. I think we see a lot of enrollments come from Iris, and I think they come over to us because they not only need self-direction, but they need additional care. I don't think in Iris you have options for a lot of those contracted services where it kind of takes the member out of that responsibility of managing the budget. And so with MyChoice, you can do both. You can have those agencies provide you care. You're not so hands-on. You just have those agencies come in. We can coordinate services for you. And then you can also, if you want to, self-direct services through a budget. So you get a little bit of both. And I know our budget system, I mean, correct me if I'm wrong, if someone knows more about Iris than I do, but you get a budget and you can kind of use it in any way you want, right? To purchase services. It's a little different in this regard. We know what your service need is because we've assessed the need, we've talked to you, and based on that need, we can go many different routes. It can go SDS, or it can be a contracted provider, or both. And your budget's going to be based on that service category and what your need is. So it's not just kind of a lump sum of money to do what you want with.
Wonderful. Thank you.
Mm-hmm. Sorry, that's a little hard for me to answer, not knowing, the ins and outs of Iris, but.
No, it's okay. And how often does your team typically meet with the member?
Sure. Right. You're quizzing me on these care management policies that I haven't brushed up on in a minute. No, the minimum expectation is once a month, they are making a comprehensive phone call. Every 3 months, they are doing a face-to-face in the home. And then every 6 months is that comprehensive assessment. That being said, it ends up being a lot more than that. You know, Monday through Friday, 8 to 4:30, the phone rings, and you have access to your care manager and your nurse. If you need something, if something's going on, things are escalating, there are different reasons they're going to come to your house or have a phone call with you. So that's just the minimum.
Yep. Wonderful. Thank you.
Mhm. All right. Types of SDS options. We have different models of SDS. We have the more traditional ones. So for each model, MyChoice Wisconsin has a contracted fiscal agency, a provider that's used. So this fiscal agency acts as a third-party vendor that processes the payments. It's likely the same for Iris. So same with our MCO as well. The first model is our fiscal employer agent, or FEA model, and it's kind of what we've just been talking about with that employee-employer relationship, and the most typically used. It is the employee-employer relationship described on the previous slides. In this model, the member becomes the legal employer, giving them that independence, that control. An example would be a member hiring a caregiver to provide supportive home care services. That caregiver becomes a member's employee, and that relationship begins. With this model holds great responsibility for the member, as all models do. But with these responsibilities, it's monitoring, signing off on timesheets or invoices, whatever that looks like, managing schedules, monitoring performance of your caregivers, and then reporting any challenges to your care team. So you really have that control and that responsibility if you're going to self-direct. And then the second model is the fiscal conduit model. And so this is when the fiscal agent would pay the member's identified provider or individual for a product or service when the identified provider is not the employee of the member. This is more of a reimbursement type payment. An example of this would be, like we talked about, a member reimbursing, or the fiscal reimbursing, a friend or family member for mileage to medical appointments, or a member utilizing a lawn care agency through self-directed supports, because those agencies are very limited throughout the state. This option allows members to choose their caregivers or providers to render their service, but there would not be an employee-employer relationship. And again, although there is no employee-employer relationship, the member still holds a lot of responsibility when self-directing using this model. They still must monitor the service, monitor performance, discuss challenges and problems with their care team, and so on.
Excuse me. So is this, would that be what, again, the transportation thing?
Yep.
Our care manager gets approval for us to use Uber when needed, and then get reimbursed.
Yep.
For that.
Yes.
We
Yep.
rarely use it. We try not to because it is expensive, but
Yeah.
but that would be that would be an example of fiscal conduit.
100%. That's a great
Okay.
example of fiscal conduit, actually, is Uber. I will just say that's something we try to find all other options first before using Uber, just because it's really hard to, it's like, we don't know how much it's going to cost, right? So to authorize utilization, it's tough, but we absolutely have members doing that. And that's a perfect example of a reimbursement type situation to make, to get the member what they need.
Right.
All right. So there are different service options and different service models, a lot to know. Members and their families want to get started right away and often want to know, how do I choose the right model? How do I know if self-direction's for me? And I think more importantly, or more often, it's what services will I be approved for and how does my budget work? These questions are all answered during the care planning process. Your budget is developed by first identifying your care plan and service need. And like I said, your care team is going to drive that with you. I'm going to briefly go over the process the care team goes through in developing a care plan for a member. I think it's really important to know these brief steps as it will give an idea of how services are approved and then how your budget is developed. First step in creating your plan for services is for the member to think about their short-term goals. What are the personal goals and outcomes? Your care team can assist in identifying your personal outcomes if you do need that assistance. Some examples are, I want to stay in my own home. That's a big one. I want to become involved more in my church. I want to find a job working in the community. So what are your main goals? What are we working towards? Those are your long-term outcomes. Then your care team and the members care team will complete a comprehensive assessment to determine what your needs are to keep you safe and independent, what supports you have, excuse me, or need to meet your outcomes, and your preferences on how your family want to receive the supports needed to meet those outcomes. The care team will meet with the member's supports of choice, in the home, phone calls, comprehensive assessment to determine the service needs and the amount of the service that's needed. And then they develop that member-centered plan. We call it our MCP. It is your care plan. Now that you've talked through personal outcomes, the needs, preferences, and support, it's time to develop that MCP. This care plan will list all of your services, your service providers, including those you plan to self-direct, and the names of individuals or agencies that provide the support. Your care plan should list services that match your needs and personal outcomes in the most efficient and cost-effective manner available. And in order to ensure this, your team will work with you, your member, to discuss all options that are available to meet your needs. Once determining all options, your team will then work to determine which option is the most efficient and cost-effective. Once your care plan is developed, then we know the service types and amounts of service you require to meet your need. You will work with your team to determine a budget for services based on your care plan. So now we know those services and the amount, and so we can work on that budget. Managing your individualized service budget is an important part of self-direction. The amount of money in your service budget is based on the needs identified during your comprehensive assessment, like we just talked about, and the type and amount of services in your service plan. So it's based on the services that the individual member needs. Determining an individualized service budget amount, your team will work with you to set up a monthly service budget amount. The amount of your budget depends on the cost of each of your services. The cost of each service is based on what a typical contract service provider is paid for that particular service. For instance, if MyChoice Wisconsin would have authorized supportive home care for a member, if the member were not participating in SDS, then the cost of the supportive home care through a contracted provider may be used in establishing the member's budget. All right, continuing on the SDS budget, setting wages. The member is responsible for setting the employee's wages. That is their responsibility. But it is also responsibility to remain within their budget. So you have the authority to set that wage and wages, and they can be different wages for different caregivers, different services, but again, remaining within that budget that you will have access to through your care team. Your care team will help you determine wages. Or the member to determine wages and can go through considerations. Some things we have members consider is, how much experience does your caregiver have, or how long have you been working with this provider? How does your caregiver have a specific license? Like we talked about, are they a nurse? Are they a CNA? how's their performance? Do you want to leave room to provide a raise in the future? Sometimes we have a lot of members just say, just give them as much as you can within our budget. And that's fair. They want to give them the highest wage. But sometimes we say, well, do you want to leave a little room in that service category to provide a raise, because you do have that control. Maybe in 3 months you monitor their performance and you have that authority to, give them $1 raise. And then just some things to remember about the SDS budget, or to know, members can have more than one service within their budget. A lot of times supportive home care, transportation, daily living skills can all be within one budget. Budgets are based off a member's weekly assessed service needs, and can be used flexibly within a pay period. Members are responsible for staying within budget limits for each service, like we talked about. Requests to provide wages or rates to employees or providers that are over the budget maximum. Those requests will go to your care team and they will be discussed on a member specific basis. So we don't rule everything out. If there are specific needs, we are more than happy to talk through those rates and wages if it's necessary to meet member outcomes. And my team is very much involved in those as well. How can we meet the members' needs at the most cost-effective way? And sometimes that means going above and beyond the budget, but something we'll talk through. And then we always talk about the risks with SDS, and this education is provided through care teams when members are looking to self-direct. Mismanagement of the budget can lead to restricting the use of SDS for service delivery. That being said, your care team will continue to educate, provide resources for a successful SDS plan and management. We want our members to be able to self-direct. So if things aren't going well, there's overages, they're not understanding it, we will jump in and figure out what the issue is and help you along, because we don't want to restrict anyone's use of SDS. And I would say that's very rare.
So Kylie, as you talk about budget, like I had mentioned, a lot of our people are in IRIS, and so they have a pretty strict budget. Is there a way to know if by changing to MyChoice, if their budget would remain the same? Is it going to be better? What are the typical rates of pay, how would that work?
Yeah, that's a really hard question to answer. That's specifically that first one about, is their budget going to be the same? Because every program is so different. So I don't know. If you are coming from one MCO or IRIS to MyChoice Wisconsin, we will make we will consider, what you were paying somebody else, and we don't want to reduce pay, but we are going to make unique considerations. I will say for something like supportive home care, at this time, $15 is typically our max for staying, for lack of better words, within your budget for supportive home care. Again, we talk through those individually to see what those, necessary increases might be if needed for that member. Transportation, we just go the IRS mileage rate every year. So that's what we follow. And so I believe it's 65 cents this year. Members can go below that. We don't typically see them go over that because then it's taxable and they don't typically want that either. If we're talking about RNs or a different license, we will see people go over that $15, right? And there's justification in that. It's just something that we're gonna have to staff as a team and talk through, is this the most cost-effective option?
So Kylie, I have a question. So a lot of our IRIS people have to deal with budget amendments for who are in academies and things like that. So what happens if someone wants a service that is maybe more than their budget, but it's kind of, I would say it's a temporary expense, like our academies, I'm just gonna use the academies they're only a couple years. With the goal, obviously, that afterwards you've gained some skills. Does MyChoice do budget amendments, or?
Yeah, so that would just be like adding a service category. So it works so differently than IRIS, where that's that would be a new need and to meet an outcome. So we often authorize that through SDS outside of the budget. So amendments or what we call exceptions,
Okay.
that's something that we always often
Yeah.
offer.
And is that the care team's discretion or the MCO's discretion? Because I know Iris has to go to the state, so I'm just curious. Who has the discretion?
Oh, yeah, it's the care team. It's the care team. And I will say if it's an SDS exception, so something that's kind of or a community support exception, something that kind of goes above and beyond what we might typically authorize, they're likely going to come to my team or some other specialized team within MyChoice to talk through that and either gain approval or insight or recommendations as to how can we make this a cost-effective plan. But we certainly authorize those type of programs through self-direction well above and beyond what their budget is, because our budget is based on service category. So if you have supportive home care, you can pay your employee X amount of money hourly. If you want to add a different service like transportation, that's like a separate service category that you will have to stay within those wages. Now, if you want something like a camp or a program, that's just an additional service that the care team is going to say, yep, that's something that you need. We can justify it, and it's either we have a contracted provider to meet that need, or they're not contracted and we have to go through the SDS route through reimbursement or something like that. So it's separate. It's a very separate.
Wonderful.
We address each service need as it comes.
Okay. So I have a couple questions here. So parents are helping their young adult now in conjunction with their team, but when the adults are gone and there's no one available to add on to help the young adult, which program is better for the consumer, like family care or Iris?
I am not the resource. I would highly suggest going to the resource center to figure out which program is the best. I think Iris folks are a bit more independent in that they can manage their own budget and their own services and find their own resources. I think MCOs, if they don't have anyone, this might be the route for them, because your care team is going to take on that role of finding service providers, paying for those service providers, reaching out to any agency to meet that need for you. And if there is still that independence there where the members can, if they're their own person, they can self-direct. You can have both. But a lot of times those folks, I think, will lean towards MyChoice Wisconsin or an MCO. We see, like I said, we see a lot of, and vice versa, but we see, Iris folks maybe transferring to MyChoice Wisconsin because they now have maybe declined or have a new need, and they're not able to manage some part of their life that now, MyChoice might have to step in and find an agency or something for.
Right. And I'm just going to speak from personal experience I'm a guardian for several people with disabilities. My people happen to have MyChoice Wisconsin. Because my people have no family.
Yeah.
I'm their legal guardian, and I love Iris. I love MyChoice Wisconsin. I think every option is great. It just really depends on people's individual needs. But for my particular two people, it's extremely helpful because I have a care manager and nurse who can help me find the vendors, find the resources, and then I can, as guardian, vet them, interview them, visit the group homes, and then make those choices based on that support. So, and I'm guessing there's a question about comparing Iris and family care. I think what I will do, just because Kylie's going to be an expert in MyChoice, is I will work on getting the ADRC to come back out and do a webinar with us and see if we can do one specifically understanding Iris and MyChoice. Because I think they're just getting confused they say, I have no clue about SDS with family care. They're having trouble understanding the difference between Iris and the family care with the SDS. the main difference is with My Choice, one part of it is you do have a case manager and nurse as your team, plus the extra people that Kylie mentioned earlier. Even with self-directed supports, correct? You have a
Yep. Oh
larger
yeah.
team, right?
Yep.
In Iris, you have your Iris consultant and your fiscal agent helping you. And then really your family or whomever is helping you with your plan is your other support.
Yeah, so we are going to approve a service category. And SDS is not a service, it's a way of delivering a service. So let's say we approve transportation for you because you need it. That if you don't have anyone to transport for you, we're approving transportation.
Yeah.
Now, with My Choice, you can get that in any way that makes sense for you. And if that's with a contracted provider where, you know, it's your hands off and we just provide a transportation provider, we pay for that for you, and that's great. Or maybe you want transportation through self-direction, where you have your mom take you everywhere and get reimbursed through mileage. So we're providing the transportation as a service, right? And SDS is just a service, another way of providing that service with our MCO.
So do people have to prove what a person needs? Like, or can you just say, this is, why we want the service because we feel it's going to help the person build this skill? Or, because sometimes I think people always wonder, how am I going to prove that they need a service or added a one-time service to their plan?
Yeah, our care teams follow guidelines and do a very thorough assessments on what the needs are. And so they'll talk with you, your family, and if there's a need there, they're going to approve the service and find the most effective way to meet that need. Maybe I'm not understanding your question.
Yep, I think a lot of times what we've had families run into, and correct me if I'm wrong, feel free to unmute yourself. But is having to justify why a service is needed and then having another person make a statement saying, well, they don't really need it, or it's cheaper to do it this way when it's not really meeting the need of a person. Like, how do you prove that this is the actual service someone needs?
Sure. Right. Yeah. It's so individualized and through
Okay,
conversation, and
right.
and
And then
every service category kind of has its own criteria as well.
yeah,
Some more costly, like a home modification, right? Or a vehicle modification. That's going to meet a lot of different criteria, and it's going to have to go through a couple different committees and routes just to make sure that that really is a need, because this is Medicaid dollars, right? So
right.
we need to make sure that we vet it's the most appropriate, and there are specific questions and criteria for that. And so I think we try to do that for each service category, but they're all very different.
All right, we got a couple more questions if you don't mind me jumping in quick. A few more. So someone said, can we switch between family care and Iris over time as needed?
Yeah.
Yep, absolutely. And you guys, if someone who's interested in that, you can let your team know, your Iris consultant and your case manager, but then you're ultimately going to have to go through the Aging and Disability Resource Center. And they will work with you to discuss Iris and family care and the other options. Because even within family care, you have choices. And same within Iris, there's lots of Iris agencies to pick from, I think 4. So they will help guide you through that process, because you're going to want to determine which providers are contracted. So like Journey 21 is contracted only with particular funders, just because those funders are the ones willing to contract with us, and others aren't at the moment. And then go ahead.
I would just say you can go on our website too, and you can see the providers directory too that we contract with. So if there's a particular provider that you want to work with, and you want to maybe select your MCO based on that's certainly an option too, and you can find that on our website. But yeah, the ADRC should certainly be the one to help.
I will find that provider directory for everybody and share it with the recording link. So I will get that for everyone. And then lastly, or one more question or 2 more questions. If a person is in family care, is there an option for people who can't manage anything on their own and don't have family to help, i.e. a non-SES option?
Oh yeah, absolutely. Yeah, with MyChoice. Yep. And we have hundreds, thousands of members who don't use self-direction, where they can't manage anything else. Maybe they're nonverbal, they're bedbound. Their care team, takes on everything. They go to that house, they assess what the needs are, and they'll get home care agencies in there. And the member doesn't have to, lift a finger in terms of self-directing any of their care. Obviously, we're going to ask their preferences and things like that, but this is absolutely the program for them.
Yep, absolutely. And I'm just gonna let people know, family care is not the legal decision maker. They are the coordinator of all that care. So if you have no family to help, hopefully there's a guardian set up, a succession plan for guardianship. If not, there is what's called corporate guardians that MyChoice can help get someone connected to, financial rep payees that they can help with. Or even there's people like me who are volunteer guardians who can assist. So
Absolutely. Yep. Great point.
and then one more question. If a client had 24/7 private duty nurse through Forward Health, can MyChoice provide services to fill any gaps in services that may occur while trying to fill the gaps? I'm being told that Iris waiver services are not allowed to fill those gaps.
I'm not exactly sure how it works with both, but if you're able to be enrolled in MyChoice in that circumstance, we can certainly fill the gaps. That's probably as best as I can answer that question.
Okay. All right. Thank you. I'll let you continue.
Okay. Well, I have just kind of a member example to go through, kind of the care planning really quick. Obviously, this is not extremely comprehensive like we typically do, just to show how we get to that maybe budgeting stage, or just using a contractor provider. So I'll kind of show how you can use both. So this member example, their personal outcomes: I want to stay in my own home for as long as possible. I don't want to stay active in the community and find volunteer opportunities. The care team goes to that member's home, makes many phone calls, talks to their support systems, and through the assessment, they found out member is their own decision maker. The member lives with their brother. Brother works Monday through Friday and is out of the home during that time. So during that time, member's alone in the home. Members supports, he has 2 cousins who are available to assist. All other family supports live out of state. So those 2 cousins, kind of all he's got, and brother. Member requires assistance with meal preparation, using the stove, things like that. Standby assistance to get in and out of the shower safely. Cues and reminders to bathe, change his clothes regularly. Assistance with laundry, check-ins for safety throughout the day. And then member is unable to drive, but would like to remain active in the community and will need to attend medical appointments outside of the home as well. Again, that's a very basic assessment. We go through kind of anything and everything during our assessment process. But through the assessment process, the care team will determine what services may be approved to meet the member's needs. In this instance, the care team has approved these services. Medical transportation, so it's approved as needed. Right now, this member stating he usually has 4 appointments per year. So that's approved. Non-medical transportation for volunteering. He wants to go to church once a week, the mall 1 time a week to get out of the house. We're approving non-medical transportation. We're approving supportive home care. Through a very comprehensive assessment, which I won't get into, we have approved 15 hours a week of supportive home care. So that's the assistance with supervision, the meal prep, things like that. So when brother's not at the home, those cousins can help, or some sort of supportive home care agency can help. And then they might have approved a grab bar. So for safety to go in and out of the tub, they had him do that, and it was very unsafe. So they might have purchased a grab bar for him. Member preferences, we obviously are going to ask member guardian preference. Member in this case would really like to self-direct all of his services. He's very independent, very great advocate for himself. He would like his cousins to be his caregivers. He's very comfortable with them, and they are available to complete the cares needed between the 2 cousins. And then the member will be the employer. His cousins will be the employees. So just the traditional self-direction that we talk about. So then we talk about service delivery method. What is the most efficient and cost-effective way to meet this member's service needs? So right now we're just talking about the services and what we've approved. So in this case, we have to meet his supportive home care need. And we do that in this case with SDS and natural supports. So members live-in brother will provide natural support when he's in the home and overnight because he lives there. So that he's just doing that unpaid as a natural support. He's agreed to do that. And this all happens through discussion and care planning, right? And then member will hire his cousins through self-direction to provide his supportive home care while his brother is not home. So he's going to use SDS for supportive home care services. Transportation is a different story. He's going to go 2 different routes, and here's why. Member will self-direct his medical and non-medical transportation. His cousins will be paid mileage through SDS for transporting him. They're available to do that. However, member's cousins nor his brother can transport him to church on Sundays due to their conflicts. So we've already approved the transportation. This is a need for him. So MyChoice Wisconsin is going to authorize a contracted provider, a contracted transportation agency to provide that need on Sundays. So for the transportation service need, he's going to use SDS and a contracted provider to meet that need. And then for the grab bar, MyChoice is going to use a contracted provider to purchase that equipment. So this is a great example of how the use of SDS in family care and family care partnership programs does not have to be all or nothing. You can self-direct some of your services while we can authorize other parts of your service plan based on your need or just, what's available in your area, your preferences, things like that. So if you want to be hands-off on some of it and hands-on on others, that's great. SDS is not all or nothing. All right. So now that services and the amount of services have been determined and approved, the budget is developed. The member decides on the wages for his caregivers for both supportive home care and mileage. Supportive home care, the member decided they'd like to start the cousins both at $14 an hour, reevaluate their performance, in a couple months, and then possibly give that a $1 raise. Transportation, the member is going to go to the max of 65 cents per mile. And then these wages are all within the member's budget. Like I said, typically $15 is our standard max, but we are always making exceptions and considerations based on a member's specific need. And then just making a note here, if you're not super familiar with the program, there's no budget for the use of contracted providers. There's just a contracted rate with MyChoice Wisconsin. You don't have to worry about any of those rates. If you need a transportation provider, for example, we're just going to go through our provider directory, make some calls and see if they can meet that need. If they can, great, we authorize it, and there's nothing the member has to worry about. Okay. So I hope that provided some insight into how we get to the care planning and budgeting process. I just want to touch now on the member and caregiver or service provider setup with the fiscal agency, because that's can be a lengthy process. It kind of depends, but the fiscal agency works as a third-party vendor. They receive and process the timesheets, the invoices, and pay the employees, very similar to Iris in that regard. And so we just want to talk about this process a little bit. The member will select a fiscal agency that we're contracted with. We have 5. A budget and referral will be sent to the fiscal agency by the care team. That's a very automated process. So everything we just went through will just be sent to the care team or to the fiscal. And then the fiscal agent will just reach out to the member and the employees or providers on that referral to get them set up as an employee or vendor. This process takes time. The member will get an employer identification number, an EIN from the IRS, as they will now be an employer. If that's the model they've chosen, they have to be an employer. Employees have to complete I-9s to be completed. as well as go through a background check. And then the background check findings can impact the hiring process. The member has to be aware of any findings and then risks and proceed that way. Again, your care team is going to, kind of be the liaison between you and the fiscal agent to make sure everything's going smoothly with the hiring process. But there's a lot of paperwork that needs to be completed prior to anyone starting for payment. And it's really like any of us starting a new job. Okay, we are getting to the end here, I promise. I want to highlight that self-directing services hold a lot of responsibility. I know I've said that a little bit throughout here, but of course, the care team is there to assist along the way. They're very hands-on, but when you choose a self-direct and become an employer, you as the employer, the member as the employer of record, hold a lot of responsibility. It falls a lot on the member as the employer. So there's a lot of things to consider. I will touch on some of the major responsibilities members procure when specifically utilizing SDS to receive services. Adhering to budget limits, choosing a wage and rate within the MyChoice set budget, right? So just making sure that the wages that you're asking for or selecting are appropriate within your wage. Again, that's through discussion with your care team, what your needs are. And then monitoring service usage. So members really need to understand what they're approved for, the service amounts that they're approved for, and adhere to that. So for example, if a member is approved 10 hours of supportive home care per week, well, when reviewing timesheets, invoices, we need to make sure that caregivers are only working, that 10 hours per week because that's what approved. That being said, if things change, and things are always changing, we just need to let the care team know it's a very collaborative process. If you need more assistance, let's talk through that and approve that prior to the service being rendered. Reviewing timesheets, invoices, monitor employees and service providers. So the member is the employer. The employee hiring and background check review, monitoring the quality and performance. Really, the member is responsible for addressing performance concerns, terminating the employee, signing off on timesheets or submission of timesheets and invoices, making sure that those are timely. That's a really big one. Making sure caregivers are submitting on time for timely payment. Managing service schedules, shifts, changes in services or scheduled backup plans. And then notifying the care team of any suspicious activity or fraud, waste, or abuse. Just notifying the care team of anything going right or wrong in their plan. And then collaboration with the care team is a responsibility, and it's an expectation with SDS. So there has to be cooperation with a comprehensive assessment. In order for us to be able to approve and know what you need and approve that service, we need to be able to complete an assessment and talk through these things with you. So you have to allow the care team to come to your home, visit your home, obviously, where you're comfortable, phone calls, and go through the required steps of an assessment to make sure we can thoroughly assess what those needs are. A caregiver skills verification is a form that is completed. Our registered nurses on your care team, those are completed by them. And it basically just verifies that this is specifically for supportive home care, just because that's mostly used in the home for SDS. It verifies that your caregiver has the skills and they're qualified to complete the tasks for you. So if there are skilled tasks, can we verify that caregiver is able to safely do that, responsibly do that task? And then just open communication is what we ask for. Just open communication to identify any changes. How are things going? Are there additional needs? Things like that.
So quick question, Kylie, we have a question kind of pertaining to that. If you as a member do not have these skills, how can you take responsibility for that? Like checking timesheets, making sure it's 10 hours a week.
If a member truly is really adamant about self-directing, like this is something they really want to do for their independence, their control, your care team, my team, we will find a way to make it work. And make it work responsibly. So if that's finding, we have some resources like that support broker I was talking about. Sometimes we can authorize them to step in and provide additional education on how to sign off on a timesheet or what to look for. Or maybe an agency can actually do that for you for a while we kind of get the hang of it. Can we find a third party to that you trust to sign off on these things for you? There are creative ways to do that if a member truly wants to self-direct. And I think that's a really big thing about self-direction too, that a member has to have a desire to self-direct. They really have to want to do it. We try not to do it as just a workaround for payment, right? I want to self-direct my supports. And even if you don't feel like you have these skills, how can we work towards you obtaining those skills to do that?
Right. So, what was I going to ask? How can I take that? So the guardian can also choose to do self-directed supports if they have a guardian.
They can. Yeah.
Okay.
Yeah. The guardian would then take on those responsibilities. We still want the member involved, as much as possible in those situations. We want to make sure that the fiscal agency knows that kind of everyone's in agreement with this, and that we just keep an eye on everything. There's when there is a guardian and we're going to do self-direction, which happens quite often, we have a third party agreement form where we really do want to find a third party to sign off and kind of oversee everything, just due to the conflict of interest. And all members are all in different situations, sometimes not great situations, right? So just some of that oversight there. But we very much allow guardians to self-direct the member's behalf.
Perfect. Thank you. And then just quick questions. What percent of eligible long-term care residents in Wisconsin use MyChoice Wisconsin? Or like what kind of percent of the market do you guys cover? And are you in all the counties in Wisconsin?
I feel awful that I cannot answer that first question.
That's
I'm
okay.
sorry. I know my supervisor would like me to be able to. And I was gonna include a GSR map for both family care and family care partnership. Because we are spread across the entire state at this point for family care. And I can send those out to you.
Okay. That'd be great. And I think MyChoice is in every county, right? Or almost every county?
Yeah. If not all, I would say almost all.
Yeah,
I don't want to
that's what I
speak
thought.
incorrectly, but yes.
That's what I thought. And just because we're on the topic of employees a little bit here, the question is, it's just, the comment is really the hard part about hiring people at $15 an hour. When you can find nowadays jobs like at Woodman's,
100%.
McDonald's,
McDonald's.
or more.
Yep.
Is there anything that you've heard of in the Medicaid world, not just MyChoice specific necessarily, that looks at addressing some of the issues that people are running into for paid caregivers and what some are considering a decent wage nowadays?
Yeah, I mean, there's always discussions on this. Like we know that, I mean, 15 is just kind of where our organization has landed in the last probably 2 years now. Prior to that, it was 12.50, and so we're always looking at the market and making sure that we can align. Those are obviously bigger decisions, but that's where we make so many exceptions on a member specific basis to increase those wages if absolutely necessary. So we're more than willing to do that if it comes to that. But yeah, I mean, we're well aware that you could work at McDonald's for $15 an hour, and we'll consider that. If there's no other options in your area, right? And you can't find anyone, or this is your only caregiver and they're going to quit because they can make $16, $20 somewhere else, we're going to take that into consideration.
Right.
And I think there's a little bit more flexibility there than maybe like Iris in terms of going above your budget, because
Yeah.
Our budgets aren't so large and encompassing all services. So we're willing to work with you on maybe going outside of that if necessary.
Wonderful. So I have a family who has their child in MyChoice Wisconsin already. The person lives in a group home, so the group home manages the transportation. However, they are interested in doing that self-directed support so they can attend church. And that is something they can talk to their family care team about, is enrolling in self-directed supports in order to get their son to church.
Yeah. Oh, absolutely. We call those transportation exceptions and we prove them on a daily basis. if
Okay.
if residential for some reason cannot provide all of the transportation because it's excessive, or there's lots of reasons a transportation or a residential provider can't provide a specific transportation or ride, we can make exceptions for that, and it can be a contracted provider. It's technically what we call duplication of service, but we need to meet this member's needs, right? They want to go to church. We've exhausted all options with this residential provider. It's just not happening. Let's get an agency that can make it work. Or if they want to self-direct, we can look at that too.
Wonderful. Thank you.
Mm-hmm. All right, I think this is last slide for me. So the care team will review these responsibilities and expectations with members, and it really does help aid in the decision if SDS is the right choice for that member. Going through, here are your responsibilities, here are the expectations, here are the risks. That's all part of the education. Really, is this something they can successfully manage, and do they want to, right? So self-direction is a big responsibility. It may seem like a lot at first, but we want you to know that self-direction does not have to be a stressful process. This is an opportunity to get members excited about their care plan. We want to empower our members and take a strength-based approach to encourage our members to direct their care. Your members are not alone. Members and their families and their supports are not alone in this process. The care team is with them every step of the way, coordinating services. Your care team will provide continued education and resources and answer your questions. There are options available. There's options available, and your care team will assist in finding the option and the level of engagement in directing services that the member wants and needs. SDS, again, does not have to be an all or nothing approach. Members can start slow. They can self-direct one service and increase their services through self-directions once they feel more confident. Or maybe they just want to self-direct transportation and the rest they just want an agency to do. Again, it's not all or nothing, and there's options available to make it work. SDS is voluntary. Members can choose to stop self-directing their services at any point within MyChoice Wisconsin. So if you say, this is too much, or it's getting out of hand, I can't manage this, my caregivers are, in and out, it's a lot, the care team will assist in a smooth transition to ensure that your needs are still met, right? So the needs, maybe supportive home care, if you don't want to self-direct, let's get an agency in there. We can still meet your needs another way. And I think that is actually one of those big differences between IRIS, right? And your care team and MyChoice Wisconsin experts will ensure you and your supports have a good understanding of what responsibilities you hold while self-directing, and will provide resources to ensure your success. We've got resources on resources available to and for you.
Thank you, Kylie. I have one question in the chat, so I'm going to ask the question in the chat, everybody, and then after that, I'm just going to ask people to unmute themselves. So the question in the chat is, how does resource sharing work under this model? For example, you have roommates splitting supportive home care services between them. Are there regulations against this, or is a helpful way for families and MyChoice to maximize the resource?
We're talking about like shared staffing, two members living in one place.
Correct. That's what, yeah, you have one person providing service to two people.
Sure. Yeah. No, it's allowed. I'll put it simply as that. And so we just make sure it's the safest option and the most cost-effective option. So we don't want like duplication of services. So we'll find a way where one staff member can provide care to both people. Maybe if they're caring for, let me supervision, right, for two people at one time, we might justify it by saying, you know, for this member during this time, you're kind of a natural support, and for this time, you're a paid support, and vice versa, depending on what those needs are. So we certainly make those work all the time. It's very member specific. How is this going to work for you? What's the backup plan if, you know, one of the members wants to go out of the house and then the other one wants to stay back, but there's one staff. So we just talk through what those needs are for each member and make it work that way.
I'm sorry, I forgot to unmute myself. Does anyone else have any additional questions for Kylie? Looks like we have one person who just unmuted.
I have a question. You mentioned, oh, let me see. Medical alert system. What do you use for that? How do you address that?
Oh, we have many different providers that can provide that type of equipment. That's not my area of expertise, but just from my experience in being in care management, like a personal landline or personal response unit where you press a button and it makes that safety call and someone can be on the speaker for you. There's many different technology options out there for that kind of system. So I would use the provider directory to see who we contract with, or, you know, talk to your care team about what's available. That landline, that what's it called, life alert type situation, that's a big one that's used for our members who want to stay, you know, independent in their home, but in case of an emergency they might need that extra assistance. That's a very cost-effective way to meet that need.
Yep. Wonderful.
Okay,
Other
thank you.
questions?
So you had said that your contracted services are not part of the budget amount under the SDS. Did I understand that correctly?
Correct.
Okay.
Yep.
So if you've got a client that needs 24/7 nursing,
Mhm.
that comes in under the contracted and does not come out of the budget.
You could do it however you want. So let's say you want to use a nursing agency that we're contracted with for the daytime shifts. And then at night, you want to use your own caregivers through self-direction. You can do that as well. So we can piece together a plan for you through self-direction and our contracted providers. And oftentimes with our 24/7 home support folks, that has to be the case because it's really hard to find caregivers who can, you know, through SDS, like private duty nurses or something that can provide 24/7 care. So oftentimes we do have to find an agency to step in and cover some hours. So in that case, we might say you're approved 24/7 nursing. We are going to have an agency step in, and then you're going to have, I don't know, 50 hours a week of nurses through SDS. So your budget is really only looking at that 50 hours. So 50 hours through self-direction at, you know, $30 an hour, whatever it may be. That's the budget piece.
So how do you, my experience with agencies in the past has been even when there weren't nursing shortages, they had difficulty staffing
Right.
24/7. And
Right.
now with the nursing shortages, you've
Right.
got an agency and they are not fulfilling the hours they're supposed to be. How do you manage that?
You could have one of your SDS caregivers step in if they're able. So that might be an exception where it's like this week they had to work more hours because the supportive home care agency couldn't provide their typical worker during their time they were supposed to be here. I will say when a member needs 24/7 support, we are going to explore all options, that being residential, that being a supported apartment, because just kind of you're bringing up the risks already with 24/7 support in the home. There are a lot of risks associated with that because of the shortages and no backup plan. And so those are hard to manage, but your care team's going to do their best to fill all the gaps with using all resources.
I'm kind of laughing because he doesn't need 24/7 nursing. He needs 24/7 one-to-one nursing.
Sure.
He can't even go to rehab after he broke his hip because they couldn't give him one-to-one nursing. So residential isn't even an option.
Yeah. Yeah.
So
That's
anyway, I'm kind of chuckling to myself because it's such a unusual case that doesn't hit everybody on this call.
yeah. Well, I vet all of those specific cases, so I'm very familiar with the kind of one-to-one needs. So I'd be happy to talk to you as well after this.
Thank you.
Mm-hmm.
I connected you two via email, so you'll be set to go.
Perfect.
Thank you.
Any other questions? Doesn't look like it. So Kylie, just thank you so much for taking time in your evening to join us tonight. Everyone, thank you for joining us, and I look forward to more webinars with everybody.
Yeah, thank you so much for having me. Please reach out to me if you have any other additional questions. I'd be happy to talk with each of you. Thank you so
Thanks,
much.
Kylie. You guys have a great night.
Thanks.
Katie,
Bye.
Katie,
Yeah,
Katie,
yeah.
is there a chance to get these slides?
Yes, I will be getting the slides from Miss Kylie. I have the recording, and I'm going to find a couple of the resources Kylie mentioned and share those. So
Oh, yeah.
probably the next day or two.
Okay, super. Thank you very much.
Thank
You are most
you.
welcome.
Very, very helpful.
Right. Bye-bye.